Our next speaker is Miss Allison Ezzat. She's a physical therapist and a PhD student in the School of Population and Public Health at UBC. She recently completed her master's at the Arthritis Research Centre of Canada with Dr. Lee. Her current research interests include injury prevention, how appropriate, in youth sports, as evidence suggests the long-term consequences of these injuries is often the development of earlier osteoarthritis. So, Ms. Ezzat must be close by. Thank you. Thank you.
Thanks very much for the introduction. As Celine said, I'm a physiotherapist and I've been working clinically in West Vancouver for 8 years, and just recently went back to do some research at the Arthritis Research Centre, and now I've moved on to continue on my arthritis research path, although moving to a little bit of a younger group. But as you'll see here, what I hope to share with you today is a little bit of information about how your work activities could impact your risk of osteoarthritis. Make sure there we go. Great. So the work I'm going to be presenting today is part of my master's thesis, which I did with Dr. Lee as my supervisor, and also you can see as my committee members with Dr. Sibert. And I just also like to acknowledge my funding sources as well. Knee osteoarthritis is caused by the interaction of many factors, as Pam and Yolanda have already gone over, Dr. Sibert have gone over. So these factors don't necessarily mean you're going to get arthritis, but it's important to understand each of these factors interact together. So as we've already heard, being of older age makes you more likely to get osteoarthritis. Being a woman, having a previous injury, being obese or overweight, and finally also being exposed to high physical loads. And this could be through participating in sports, through different jobs, or through household activities. Now, physical activity, as we just heard from Dr. Lee, is needed for healthy joints. It helps to stimulate bone development from an early age. It helps to make your muscles strong, to support your joints. And as well, the cartilage that's on the end of those bones, as Pam was talking about earlier, it needs physical activity to help keep the joint surfaces smooth and moving on each other. However, with all types of physical activity, you get loading in the joint, and there is some evidence that too much loading can cause damage and that this can contribute to osteoarthritis. So work is one source of joint loading. Work can be defined as what people do in their daily life, at their workplace, or also at home. So this can include tasks such as heavy lifting and kneeling. Now, as you can probably imagine, being able to accurately measure the amount of joint loading that people do can be challenging. So in the previous research, they've tried to do this in many different ways. So for example, there's big databases that they've made where they have lots of hundreds and hundreds of jobs listed, and they've said that if you're a carpenter, this is how much kneeling you do, versus if you're a teacher, this is how much kneeling you do. But you can imagine that not every carpenter is going to do the same amount of kneeling than the other carpenter. So there's a few problems with that method. Some other studies have also done videotaping, where they've videotaped people doing their job for a week, and then after the videotaping, they watch it in slow motion and they actually record how much kneeling that person does, which you can imagine is quite time-consuming and tedious to do that. So there's lots of different ways this has been done. But what does the evidence say? So when all the studies are put together and we look at the quality of evidence, there is good evidence that there's a link between physically demanding jobs and knee osteoarthritis in men. However, in women, the evidence is much less clear. So what we set out to do in my study was to first of all try to accurately measure the amount of lifetime work-related knee loading that people were exposed to, and then to try to assess the link between these work activities and then developing knee osteoarthritis in both men and women. The data that I used for my study was already collected from a previous study that Dr. Sibert had been involved with. And for my study, we used what's called a cross-sectional study design, where all the data is collected at one time. And that sort of called a snapshot study design. There were 317 people who we looked at in the study. They were both men and women, and they were between the ages of 40 and 79 years old. 255 of them had knee pain, and 73 people had no knee pain. So all of those people had clinical knee exams done by a rheumatologist. They underwent x-rays, and then they also filled out very detailed questionnaires that asked them questions about medication use, their weight, their past activities, their history of injury, and of course, their past jobs as well. So this was the area that I was interested in. The question specifically asked people to list every job that they'd had for at least a year since they were 18 years old. And importantly, we asked them to include time when they'd been a homemaker as well. So we asked them to report how old they were when they started the job, the number of years they did that job, and then they had to give themselves an activity level score on a scale of 1 to 5, and also a knee bending or kneeling score on a scale of 1 to 3. And then we took this information together, and using a formula, a few multiplying and adding numbers together, we calculated a score that represented that person's total work loading that they'd been exposed to over their life. So now to share with you some of the results. Out of those 317 people, there was 102 people who had osteoarthritis. And we defined that as they had to have both changes of osteoarthritis on an x-ray and they had to have pain. The rest of the people, 225 people, didn't get diagnosed with osteoarthritis. So now this graph looks a little confusing here, but what I'm going to show you, I thought I was hitting the laser pointer there. Oh. Okay, there we go. All right, so what I'm showing here is, as I said to you before, that every person in the study, those 317 people, were each given a number that represented their loading score. Then we grouped people into these 4 different groups. So group number 1, that was the people who had very low loading scores. And then the group at the far end, that's group number 4, they had the highest loading scores. Then we were able to compare between these different groups. I'm scared to use this laser pointer, so hopefully there's group 4 and there's group 1, right? Okay, so what I was just saying is we compared the high group on the end group 4 to group 1, and what we saw was that there was 8.2 times greater odds of osteoarthritis in the people in the high loading group, both men and women together. So much, much greater odds if you were exposed to high loading at work. So then we separated into men and women, and what we saw was that in women there was actually 9.7 times greater odds of osteoarthritis in the people exposed to high loads, so even greater odds. Whereas in men, we saw no difference, which is a little bit contrary to what the previous research I told you has been saying. So what does this mean? I need to speed up here because I'm running out of time. So what this means is our method was a new approach, and it allowed us to get individualized numbers that accounted for people having multiple jobs over their lifetime, which hasn't been done in very many studies before. As well, it allowed us to account for unpaid jobs, such as being a homemaker. So we think that our research, part of the reason our research showed this high risk in women is because we included this information about being a homemaker, which hasn't been included in many of the other studies. So that's kind of one of my take-home messages here. So what's next? There hasn't been a lot of information or a lot of studies done on how to prevent knee osteoarthritis in the workplace. So there's a few ideas that looking at new work methods, looking at possible equipment such as knee pads, or teaching people and training people better ways of lifting. And then importantly, my last slide is what this means for you. So if you have a physical job that involves a lot of heavy kneeling and lifting, there are a few other risk factors you can modify, as have already been talked about. You can make sure your muscles are strong to support your joints, and you can make sure you maintain a healthy body weight. As well, some other work tips would be make sure you're using proper body mechanics when you're lifting and kneeling, and to make sure you're changing positions frequently while you're working. And as has already been mentioned as well, it's important that if you're having knee pain at work or any other time that you should consult with your doctor or a physiotherapist. So, thank you.